We have lived through the Delta variants and the Omicron variants, and now we are living through an Omicron subvariant that's called the FLiRT variant. How should we think about all these new variants that keep arising? My name is Li Yang. I am an infectious diseases doctor by training, and currently I'm Vice Dean of Global Health at the NUS Hock School of Public Health. There's a surge in COVID-19 cases in Singapore, in particular the FLiRT variant that's been circulating around many countries, and there is a sense of déjà vu every time a new variant arises. There's a lot of concern whether there would be more hospitalizations and deaths, and whether the vaccines still work. Currently, the FLiRT variant is considered by the World Health Organization as a variant under monitoring, which means that it is not a significant threat. This is part of the natural evolution of the virus. It will mutate. For the most part, these infections have not been more serious, more virulent, or caused more deaths and hospitalizations, especially in individuals who have already been vaccinated, boosted, and/or infected in the past. The Ministry of Health has advised that the elderly should go for an updated booster dose against COVID-19 to minimize the risk of them being infected by the new COVID-19 variant. One of the questions people might ask would be whether they should wait for an updated COVID-19 vaccine that incorporates the current variant in order to be better protected. But this would not be advisable because it would take many more months before a new updated COVID-19 vaccine becomes widely available, including in Singapore. Is there a benefit or a point to being infected by the latest COVID-19 variant so that we can become immune? I generally think that this is not a good idea. Even if one is healthy, the feeling of being sick, of having fever, sore throat, and cough, that's something that we should avoid if possible. And more importantly, someone who is infected may pass the virus on to individuals at home or at our workplace who are more vulnerable to severe illness. For those who are elderly, for those with compromised immune systems, getting infected is always a bad idea because even mild infections can tip one over towards hospitalization and complications arising thereafter. What is important to understand is that organizations such as the World Health Organization, US CDC, and even the Ministry of Health in Singapore monitors and tracks new variants as they arise and assesses as to how dangerous they are compared to previous variants. I think for most of us, the key thing is to stay informed, stay updated, but to live our lives as normally as possible.